Hello, welcome to drvtrust.com. I am Dr. Hemant Kumar. COVID is usually a self-limiting disease which resolves itself anywhere between 14 to 21 days from the start of the infection. However, doctors are noticing worldwide that a subset of people who get infected by COVID, they continue to experience symptoms related to COVID much after the initial infection has subsided or it's expected to subside. So this subset of patients are known to be suffering from what is known as long COVID. So by technical definition, patients who continue to exhibit symptoms of COVID more than 8 or even 12 weeks after the initial COVID infection are said to be suffering from a long COVID syndrome. Now, what are the symptoms that would identify a person as to be suffering from long COVID? Well, there are two parts to the symptoms. First are the symptoms which are an expression of symptoms which are seen in a COVID infection itself. For example, breathlessness, cough, sore throat, fever, loss of sense of smell, loss of sense of taste, loose motions, diarrhea. These are the symptoms which are normally also are associated with COVID, and long COVID patients continue to see them. However, a new set of symptoms are also emerging in these patients. Usually these symptoms relate to three organ systems: the brain, nervous system, the heart, and the gut or the digestive system. In the brain, the effects are loosely called what is called a brain fog. Patients continue to feel that they don't have a clear head. Their memory is impaired, especially the short-term working memory is impaired. People can't concentrate on a task. If you're trying to do something which is mentally taxing, you feel tired very, very quickly. You feel confused pretty quickly. And some patients are also reporting symptoms of tingling, pinpricks in the body, and a patch of numbness here, which would shift to some other spot after a while. So these are symptoms which were not there in the original infection and are now seen in long COVID patients. When we come to the heart or the circulatory system, a subset of patients are experiencing what is known as postural tachycardia. See, when you stand up from a sitting or a lying down position, our body has an automatic mechanism to adjust for the flow of blood which goes down because of the gravity. In these patients, this automatic mechanism seems to not quite adjust quickly enough, and as a result, patients experience fast heartbeat and the sensation of pounding in their chest, which is known as palpitation. So every time they will sit up or stand up from a sitting position, they will experience this painful sensation of being aware of their heartbeat. So this is known as postural orthostatic tachycardia syndrome, or POTS, in these patients. Then there are a subset of patients who experience gastrointestinal symptoms like loose motion, experience indigestion or acidity, or poorly formed bowels, and so forth. Now the question arises is that who is more likely to get long COVID? See, people who get admitted to a hospital because of COVID are more likely. People who got admitted to a ICU or an intensive care unit are much more likely to get a long COVID. Women are relatively more likely to get long COVID. But an important part here is, for any of the youngsters watching this video, is that even among youngsters, these symptoms of long COVID are being seen around the world. So it is important for you to understand that even if the initial infection is mild or even asymptomatic, it is not a guarantee that you may not experience some of the long COVID symptoms. So please continue to take all precautions that you can to prevent COVID and get vaccinated as soon as possible. What is the management or treatment of long COVID? Well, unfortunately, doctors have yet not been able to pinpoint as to what is the exact cause of these symptoms related to long COVID, and therefore there is no single precise treatment yet available for long COVID. So generally there are two aspects of managing a long COVID case. First and foremost, if you are experiencing these symptoms, then please be in regular touch with your doctor. The reason being that, contrary to popular belief, COVID is not just something that affects the lung or the respiratory system. There are a number of chemicals which help in combating the infection of COVID within our body. And unfortunately, even after the infection has subsided, the level of these chemicals continues to be at an elevated level in our body, and that is what produces a lot of these symptoms. In a lot of patients, what is happening is that if they were on steroids, for example, their underlying sugar or diabetes may have got exacerbated. So if it was a borderline diabetes, it may be frank diabetes now. If somebody was already a diabetic, they may have a really poorly controlled diabetic. And now some of these symptoms may actually be because of this diabetes. So a number of underlying conditions may have sort of manifested itself, and being in touch with your doctor, going through some additional tests may actually help find out that cause and may lead to sort of amelioration of these symptoms. As to what you can do, the only class of drugs that so far seem to be working are the over-the-counter or some prescription painkillers like paracetamol or acetaminophen, which is usually taken for pain relief or fever. I may caution you though that do not self-medicate with these medications for a long period of time because they have side effects of their own. Now, in terms of other non-medicational things, what you can do is, first of all, please be aware that this is a real condition. Millions of people worldwide are reporting these symptoms or this syndrome of long COVID. So be kind to somebody who's suffering from long COVID, and if you unfortunately yourself are suffering, then please be kind to yourself. Acknowledge that yes, this is a problem that requires a solution. Secondly, most people would report fatigue of an extreme degree. You just don't quite feel like getting out of the bed. You can't focus on your task, as we discussed before. So it is important that you plan your task, whether it is physical or mental. If you have a presentation to make, a project report to make, some household chore to do, see if you can break a 30, 40, an hour-long task into 4 chunks or 5 chunks. Frequent breaks would help. Stretching exercises have seemed to help. Yoga seems to help in a number of patients. Deep breathing exercises help, especially patients who are experiencing bouts of breathlessness and cough. Pranayam seems to be helping some of these patients. What you should avoid doing: do not think that I will push my way through this problem quickly and in one go. That okay, I'm feeling weak and it's been 15 days, 30 days I've been sitting at home, I'm going to put on my running shoes and I'm going to walk for half an hour or start jogging. You may actually experience dizziness and you may actually fall to the ground. So do not try to push yourself through suddenly. The good news is that with passage of time, these symptoms improve in vast majority of patients. And one more thing that is seemed to be working for a lot of people is to be a part of social media groups of patients who are suffering similar symptoms. It seems to be helping a lot of people. So these are some of the steps that you can take in managing this huge problem which is known as long COVID. I have a request to make. If you have liked this video, please subscribe to our channel and press the notification button so that our new videos can reach to you as soon as possible. Thanks for watching. Bye-bye.